Good evening and welcome to the second in this series of conversations about human brains produced by Fondazione Prada. I hope you've had the chance to watch the two fascinating lectures by tonight's speakers. They're both neurologists, Professor Guido Gainotti and Professor Paolo Bartolomeo. During this live session, we'd like to invite the audience to interact and send in your questions for the speakers using the chat box, and you can do that at any time. The subject of this conversation is hemispheric lateralization and attention mechanisms. So we're focusing on the two halves of the brain and looking at how cognitive functions are shared across the two hemispheres and how damage to certain areas can cause an asymmetry of attention. Here to present and discuss this topic then are two professors of neurology. Professor Guido Gainotti is a clinical neurologist. He was a professor at the Institute of Neurology in the Catholic University of Rome from 1989 to 2012. He's now Professor Emeritus of Neurology in the same university. He's edited many international journals and the Handbook of Neuropsychology, and he's published around 300 papers in psychiatry and neurosciences. He's focused in particular on right hemisphere dominance for our emotions, on the mechanisms that underlie unilateral spatial neglect, which we'll be talking about quite a bit, as well as recognition disorders as well. Professor Paolo Bartolomeo trained in Rome as a clinical neurologist and as a neuroscientist. He's now research director at the Inserm, the French Biomedical Research Institute, and he leads the wonderfully entitled Picnic Lab, which stands for Physiological Investigations of Clinically Normal and Impaired Cognition at the ICM, the Paris Brain Institute in the Pitié-Salpêtrière Hospital. He's the author of more than 160 academic papers, and Paolo and his team have done extensive research on attention, perception, and consciousness in patients with neurological disorders and as well in healthy individuals. This work has revealed links between the structure and the function of the brain, and the long-term aim is to bridge the gap between neuroscience on the one hand and clinical neurology on the other. So welcome to both of you tonight. Thank you very much for joining us for these human brain conversations. First of all, you've given those two lectures, which are available online on the web for some time after these live events. But just in case people haven't seen those lectures, I wonder if you could just quickly summarize what your talks were about. And Guido, if I could ask you to start, please, by just giving us a quick summary of your lecture.
Yes. So I'm going to focus my attention on spatial hemi-neglect or lack of attention for the left half of space, which is observed in patients with right hemisphere lesions. This is an extremely severe disorder, severe for one's daily life, as well as for the cognitive activities of these patients. Now, what is it? Well, the fact is that these patients totally forget what happens to their left. And this inattention is surely not due to a visual field deficit or to other elementary disorders. Also because similar disorders for the right half of space are rarely observed in patients with left lesions. In addition, this disorder in these patients does not seem to be due so much to a voluntary deficit, an intentional deficit, but it's automatic, meaning that the patient automatically does not focus their attention on the left. And why don't they do so? Well, apparently this depends on the fact that the attention is being automatically captured by stimuli placed on the right of the visual field. So the presence of these stimuli on the right prevent attention to focus on the left. Now, This is being confirmed also by neuroanatomical and neurophysiological data. In the brain, we have some fiber bundles that allow to focus the attention automatically or voluntarily. And what we see is that the bundles that are necessary for the voluntary orientation of attention are present both in the right and left hemisphere, while those that underlie the attention to the contralateral hemisphere are more developed in the right hemisphere. Now, since this is an important function, it's a nonverbal function, and that is responsible for many important functions in both animals and in humans. But since in humans language is being represented by the left hemisphere, we wonder if this representation, this type of spatial orientation to the right, may be partially linked to the existence on the left of a system that is important for language processing. And I say this because language is an extremely important tool for cognitive processing, which is not useful only for verbal or nonverbal communication, but it is necessary also to structure the cognitive activities of the brains based on a more intentional, more conscious modality, or instead based on a more automatic and more conscious type of activity. So this is a bit a general summary of my lecture.
Thank you very much indeed. It's absolutely fascinating. I've got so many questions, but before we launch into questions, I wondered, Paolo, if you could do the same, if you could briefly summarize your lecture in just a few minutes.
Yes, as we know, and as Professor Gainotti was saying, the brain is made by two halves, the right hemisphere and the left hemisphere. In most people, the left hemisphere is important for speaking and understanding language and for controlling movements, while the right hemisphere has different functions, including directing attention in space, although it's not just the right hemisphere that does it, but it's dominant. Many stroke patients in the right hemisphere, as Guido was pointing out, lose their ability to pay attention to events occurring in the left side of the space. Now, this disorder is called hemi-inattention or spatial hemi-negligence. These patients do not eat food contained on the left side of their plate. They do not shave or apply makeup to the left half of their face. And if they walk, they can bump into objects on their left-hand side. Now, these issues are caused by lesions in circuits in the right hemisphere controlling orientation of attention in the space. These are circuits that normally tell us, among other things, when an object from the external world is important and requires our attention. Recent data show that these circuits can also be important for processing information or be conscious in terms of all the events in the external world or aware of them. These do not only imply the working of the right hemisphere, but also the left hemisphere, the healthy one, which does not get appropriate information from the right hemisphere, and therefore directs the attention automatically, as Professor Gainotti was pointing out, towards the event on the right-hand side. Each single hemisphere controls more or less what happens in the opposite hemispace. Therefore, the left hemisphere in these cases can have a negative action in those patients suffering from neglect. After a few months after the lesion or stroke, in some cases, the left hemisphere seems to be able to help compensation and retrieval of all these orientation activities in terms of attention. But this seems to happen only if both hemispheres, left and right, can, so to say, speak to each other through connections between the two hemispheres. If the lesion affects these connections as well, it is very likely for the patient not to recover from hemi-neglect and therefore continues to show inattention signs for the left-hand side of the space. Therefore, it's possible that communication between the hemispheres makes it possible for recover hemi-negligence and then compensate for it. And this might be a more general mechanism, for instance, for the retrieval of language deficit after the lesion to the left hemisphere. In some cases, the right hemisphere, which is the healthy one in this case, can compensate for these deficits. Therefore, a challenge for future research is to find strategies to help this communication between the two hemispheres, the healthy one and the diseased one, so that you can switch from a situation of competition between the two hemispheres to a situation of cooperation or collaboration between the two.
Thank you very much indeed for those summaries. They're absolutely brilliantly clear. And if anybody watching hasn't seen the whole lectures, I'm sure your appetites will have been whetted now, and you'll want to go and watch the extended lectures, those 20-minute lectures on the Fondazione Prada website. I think what's fascinating listening to both of you is that you both have that approach to the brain where you're obviously fascinated by the way that the brain works, but you're looking at it in a really clinical way. So you're looking at it in a way in which, especially Paolo, as you were just saying, the more we can find out about how the brain works, the more that we understand how to help patients who have had lesions like strokes. And I think that's terribly important. And we're also getting a little bit of insight, I think, from both of your talks into just how disabling these lesions can be and how impactful they can be on people's lives. Before we start to get into some questions from our audience, and we've got questions that have come in from our audience online before this evening. Thank you very much for sending those in if you did. But we've also got some live questions coming in from our audience. So I would remind everybody that you can send in live questions. Please carry on doing that. Before we get into those questions, I just wondered if you each had questions for each other at this point, because your areas of expertise are similar, but you have different experiences and different expertise. So I wondered if, Paolo, you'd like to ask a question of Guido at this point.
Yes, indeed. I'd like to ask Guido something about the awareness of the disorder from external world in these patients, because patients with hemi-negligence often have little awareness of their disorder, almost always unaware of what's happening. Would this suggest some sort of relationship between hemispheric lateralization and conscious experience?
I believe that when we speak about the conscious experience, we should differentiate between various levels. The fact that language is focused on the left hemisphere, this causes that experiences and functioning are usually more intentional and are usually more self-aware if they're on the left hemisphere, while they're more automatic on the right. So within this general approach and the impact that language can have on the two hemispheres, well, surely what we can observe is that if there is a deficit which depends from a lesion of the right hemisphere, often the patient is not fully aware of this deficit. Disorder that struck a lot in the first half of the last century was the agnosia, so the lack of awareness of the hemiplegia of the patient that suffered a stroke of the right hemisphere. So even if it may seem strange, these patients who cannot move the limbs to the left, they do not realize that the left half of the body is not responding to their commands. And if one asks them, did you raise the arm? Well, the patients can answer yes, even if in reality they were not able to move the arm. So this lack of awareness of the disease that we observe with hemiplegia is even more accentuated if we have visual heminegligence. It may be that this depends on the fact that, as said, if we have heminegligence, an important component of this is the difficulty in the automatic orientation of attention. And the automatic processing is one of the factors involved and which can explain this reaction in the patient.
Thank you very much, Guido. And would you like to ask Paolo something in return?
Yes, I have a question to Professor Bartolomeo. He made very interesting studies on this topic. And I would like to ask him if he can add something to the fiber bundles responsible for voluntary orientation and that for the automatic orientation in both the right hemisphere and the left hemisphere.
Well, yes, let's say that we are rather aware and rather knowledgeable about the architecture of these networks. These are frontoparietal, connecting the front to the posterior areas of the brain. And as you were mentioning, we know that there are symmetrical networks or fibers which are symmetrical, which are indeed higher up in anatomy. We call them dorsal, and they orient attention into space. They're connected to the region of the programmed ocular movements in the frontal lobe, connected to the regions of the parietal lobe. And these indeed give you the chance of knowing how important perceptive-wise objects are. So these dorsal fibers orientate attention into space, both automatically and voluntary. But what's peculiar about the right hemisphere is that there is a more ventral set of fibers that goes into the anterior and posterior. And this network does not orient directly attention because it doesn't have motor tasks, but it's as if it were an interface between perception and movement, because it seems to be defining objects worth my attention in space, which are important to me. So when this network is ventral or has ventral lesions or connections with the dorsal part of the right hemisphere, you have signs of spatial neglect.
Thank you very much indeed for that. I think for our audience, we're all very comfortable with the language of neuroanatomy, but just to elucidate those terms for our audience, it is tricky, isn't it, with the brain? When we talk about dorsal, because the brain is essentially kind of folded over during embryological development. Dorsal is towards the top of the brain, ventral is towards the bottom of the brain, and then we've got anterior towards the front and posterior towards the back. So these are just terms that that anatomists like myself use, but clinicians use as well, so that we know where we are in 3D space within the brain. And I just wanted to pick up on something that you said there, Paolo, which really caught my attention. And it was that you're talking about this anatomy and the wiring of the brain, these tracts within the brain, which are essentially the wires connecting one area to another. But how has it been possible to map out those pathways and work out not only their structure, but also their function? How is that possible?
Well, there are typical and classical anatomic techniques that are very well known by great anatomists from France, like Tejerine, who studied in the brain of corpses all these wirings. But since a few years, thanks to an important insight, technical insight, you can highlight this wirings also in a living human brain. This is called nuclear magnetic resonance with consequences of diffusion. This is a technique that allows you to map out the direction of the spread of these water molecules in the brain, and starting from all these recordings through this technique, you can rebuild, at least hypothetically, the trajectories of the fibers that are like the white substance that are the wirings connecting the various areas in the brain.
That's fantastic. I mean, this is this technique, which is also known as functional MRI, that allows us to not only see the structure of a brain inside a person's head, a living person, but to watch it working. I mean, it's quite amazing, isn't it? I think these are techniques which anatomists and doctors of the past couldn't even have imagined we would ever be able to do that. And we're learning so much, and it's all very helpful to those patients as well. Well, I think we should move on to some questions from our audience. So I've got this one, which is for Guido, I think. What is the psychological impact of left neglect? So again, really thinking about the patient's experience there. Guido, what is the psychological impact then of left neglect?
The psychological impact is not that important in reality. And this because of what I was saying before, because the patient has little awareness of what is taking place. A general rule that we have in psychology is that to suffer or to elaborate psychologically a specific event, we must be fully aware of that event. But if we're not fully aware, then our elaboration, our processing is limited. So this is the fundamental reason for my answer. Then, in addition to this, there is a difference in the emotional behavior that we have in patients that with lesions of the right and left hemisphere. If the lesion is at the left hemisphere, they have a catastrophic, dramatic reaction, but psychologically they are appropriate because what happened to them is indeed catastrophic. While patients with have a right lesion often have an apathic type of behavior. They are indifferent. So at times they're even ironic, they can be sarcastic. But we have behaviors that tell us that the emotional component in these patients is perhaps anomalous, like the language of those with a lesion of the left hemisphere is not lost, but it's anomalous, so they cannot communicate what they would want to communicate.
That's really fascinating, because I think intuitively you would imagine that it's an extremely distressing syndrome to experience. So that is fascinating. I mean, what about the kind of the wider context of that, though, for the loved ones and the families of somebody who is suffering from that kind of that kind of neglect, that kind of negligence, rather, of attention?
Well, the patient, as mentioned, are not fully aware of what has happened to them. Well, of course, the family members are totally aware of what happened. Now, it is interesting to notice that, for example, the first case of agnosia that was described by Babinski already in 1821, well, at the time, he had noticed that the family members of patients who did not were aware of the hemiplegia, well, they considered this disorder as, how can I say so, as a sort of a protection for the patient and themselves. So they tried to maintain these patients protected vis-a-vis the possibility of becoming aware of something that would have been extremely painful to them. So things are always complex, of course. There are anatomical factors, there are physiological factors, psychological factors involved. And we have to try to put together all of these heterogeneous components.
Thank you very much, Guido. I've got a question here that's come in from our audience for Paolo Bartolomeo. Are there, in the history of neuroscience, any other case studies that are as emblematic as the so-called patient tan from the 19th century? So that question means that you have to briefly explain who patient tan was, and then let us know if there have been any other case studies that are similar or as iconic. Over to you, Paolo.
Yes, thank you. Patient tan is a patient that was being observed here in Paris from the Bicêtre Hospital by Paul Rocca, a physician from the Bicêtre Hospital. It was a patient who could no longer talk. The only thing that he would say was tan, 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 this syllable. So that's why they nicknamed him Monsieur Tan, Mr. Tan. And this patient in 1861 died because of a cause which was not related to this brain problem. And Broca got his brain and realized that there was a lesion affecting a very specific region of the anterior area of the left hemisphere. And Broca at that point drew this conclusion, which is still acceptable today, that is, we speak with the left hemisphere. And there were other cases later on described in literature, some famous cases by Nervike, another neurologist, showing that patients with more posterior lesions may speak normally, but no longer understood what they were being told. So they had an issue in terms of understanding with a language production which was relatively normal. From then on, and we are here at the end of the 19th century, physicians started to understand that all the regions in the brain were not equivalent, but might play specific roles. And from them, we had the first proof and piece of evidence that the two hemispheres, the left and the right, did not play the same role, because similar lesions in the right hemisphere would not cause similar language disorders. And patients like Mr. Tan were often described. Let's say that now in science, describing single cases is no longer, so to say, fashionable between quotation mark. And it's a pity because thanks to the neurologic advances in neuroimaging, now we can indeed achieve data which are very specific and accurate, not only in terms of the site of the lesion that may cause a certain deficit, but also in terms of brain networks in which this lesion may be found. Therefore, it is indeed the time to study in detail patients, that is, single cases of different patients, which is something which is being done by some teams, and we are trying to do that. But from the point of view of science, I have to say that right now it's rather tough to be able to publish single cases, and that's a pity, because you get lots of bits of information from these patients on the normal working of mind and brain.
That's really interesting, and that gives us a bit of an insight into the world of science and how science itself works, and the idea that studies which involve large numbers of people are always going to be higher quality and are to be sought after. But just as you describe, especially with these new techniques, we can look in incredible detail at a particular case, at a particular patient, at how their brain is working, and learn an awful lot from a single case. Do you think we'll see case studies coming back in then? I mean, case studies along with larger trials?
Yes, I think so, and I hope so, at least. That's what we're trying to do right now. We really hope that also editors and directors of scientific magazines may realize how important it is.
Thank you very much, Paolo. And I've got quite an interesting question here for Guido, I think. Yes, it is for Guido. So the questioner is asking about the example that you mentioned in your lecture, actually, where an aphasic patient was asked to name the image, which was an image of the Madonna, the Virgin Mary, and the patient automatically succeeded thanks to emotional connections to the symbol. And this questioner says that says a lot about the cultural background and the unconsciousness of the patient, or the unconscious appreciation of what the patient was looking at. Do neurologists present different images during tests according to different cultures? Because obviously those images are very culturally specific. Guido.
We should say first that the problem is in reality much simpler than it appears. We don't have to present images that differ depending on the religion or the culture of the individual. These are two different levels of the processing of language. I can give an example of what I mean. The term Madonna can be produced based on two processes. The usual one is that a person has the image, one elaborates consciously information, one looks up for such information within one's own dictionary of words, and one grasps the right term for that specific image. This is the typical type of working modality of the left hemisphere. Instead, we have another possibility, which is that of having a series of imprecations that we can use, of automatic type of language, even of cussing, that can come out in a specific emotional condition. And so the term Madonna, which may be impossible to be found within one's own vocabulary of the aphasic patient, well, it can be pronounced by the same aphasic patient if there is a state of frustration or of stress or of rage, as is the case when people once, for example, took us. And the same patient of Broca mentioned by Paolo was a patient who, apart from saying tam-tan, he also had another type of phrase, Sacrement de Dieu, meaning the sacred name of God, so to say. So another type of saying, which for reasons linked to his personal history, had remained among the expressions that he often used automatically, and hence he could speak that automatically, being there the impossibility of being able to find voluntarily some appropriate terms.
Absolutely fascinating. We've got some more questions coming in from our live audience, actually, and there's an interesting one here about ADHD, so attention deficit and hyperactivity disorder. In the brain of somebody who has ADHD, is there any evidence of an imbalance between the two hemispheres? Who would like to start with that one? Paolo, do you want to have a go?
Yes, indeed. There are, let's say, that thanks to these new neuroimaging techniques, we were able to check and see that in at least some of these patients having a disorder, an attention disorder or hyperactivity, etc., there are slight malfunctions, not big lesions such as in patients with spatial neglect and etc., but there are finer lesions exactly in those circuits that we were mentioning earlier on, controlling attention, particularly automatic attention. And by this, I mean that in at least some of these patients, these circuits, particularly the ventral network of attention in the right hemisphere, doesn't seem to be working properly. And once more, and once again, this is not a severe disease such as that of patients with neglect, but smaller malfunctions that can indeed influence the behavior of these people, that is, their incapability of focusing attention for a long time span, for instance.
That's fascinating. Thank you very much for that. And I think a question here I'd like to direct to Guido, which is about the evolutionary basis of lateralization in the brain. So do we understand that? Do we understand evolutionarily why our brains are lateralized in this way? And do other animals have lateralization? Guido?
Let me start with the second part of the question. While up to some decades ago, we were convinced that the hemispheres and the study of hemispheres, which, as was mentioned, was started when we showed that language was in the left hemisphere. So we were convinced that it was a human condition. But in the last decades, we have seen that certain forms of lateralizations, and this for a series of activities, especially for perception, for emotions, for the processing of information. So apparently the brain seems to work differently to the left versus to the right, and this asymmetry seems to be present also in animals. Paradoxically, it's started even in the invertebrates, meaning in animals with a brain that was totally different versus the human brain. So in animals without the corpus callosum, as an example. So We should say that, however, not all the research that was carried out is methodologically perfect. So some criticism can be made against such research. But apart from this, the fact that lateralization is not only a human trait is indeed something valid. And of course, this will require additional studies in the future, more detailed studies. Now, as for the reason why we have lateralization, well, it could be that there are maybe some functions in which a spatial link between various structures may give rise to disorders in the subject. A difference which is often made is one between emotions on one hand, or an emotional system on one hand, and the cognitive system on the other. The emotional system is an emergency system. It is used in states of emergency so as to be able to take decisions as fast as possible and to trigger the response pattern. Cognition, on the other hand, is a very different system. It requires longer times so as to process in a controlled and conscious way the existing problem. So it may be the coexistence in the same hemisphere of structures that have to process the emotional response as well as those of the cognitive response could be counterproductive. Because at times, cognition may block the immediate response of the emotional system, because that could be inappropriate, and one may require more time for the processing than the other. So the separation of these functional systems, systems that are not compatible one with the other, may be one of the general reasons that may explain why we have lateralization.
That is utterly fascinating. Thank you very much. I mean, I had no idea that other animals exhibited lateralization as well. And I think that probably is that enduring pitfall of imagining that humans are completely exceptional and that actually we're so separate from the rest of the animal world. You know, our brains are extraordinary. They're incredibly large compared to the brains of any other animals. But it's amazing that we can see some similarities there between the way that these functions are divided up in the brain. And I think such an eloquent explanation of why that might be as well, Guido. Thank you very much. We have another question that's come in from our live audience, which is about colossal inhibition, which says colossal inhibition assumes that stimulus-driven activity in one hemisphere is going to suppress activity in the other. Colossal inhibition being a flow of information across the corpus callosum, which is the connection between the two hemispheres. So the questioner says, given that this view assumes that if one hemisphere is particularly active, it's going to be suppressing the other, can visuospatial training help? Paolo, could you take that question?
Yes, it is possible that these relationships based on inhibition between the hemispheres are not totally symmetric. There are data proving that the right hemisphere, particularly the posterior area of the right hemisphere, can inhibit the similar region in the left hemisphere more than the opposite is true. That is, the right hemisphere apparently is able to inhibit the left hemisphere more than the reverse, that is, the left hemisphere inhibiting the right one. And this might be meaningful within the framework of a situation, as Guido was pointing out earlier on. If there is anything urgent, I have to respond, a predator cropping up, or I'm just crossing over the road and I have a bike coming up very quickly, I have to be able to indeed react as quickly. And it's possible that the right hemisphere tries to take upon itself the response by inhibiting the left one.
Thank you very much. We've got quite a lot of questions actually, which are coming in about attention deficits. And we've already covered that a little bit, but maybe we could pull out a little bit more from some of these questions. So one of these questions is asking about poor lateralization and whether that is a sort of accurate way to describe some conditions where there is this deficit in attention. And if so, is there a way to improve that? If we can identify that an individual has poor lateralization, how can we make that better? How can we improve it? I don't know, Guido, if you'd like to take that. Is that something that you could start with?
It's a very general question, so it's difficult for me to give an answer. Also because when we speak about lateralization, there are some genetic factors involved. And we have a multitude of genetic models. There are different genetic models for hemisphere lateralization. And in addition to this, we also have environmental factors that are involved. So it is not easy for us to assess the weight of genetics and what is the weight of learning or other behavioral factors linked, for example, to the family itself. In addition, during evolution, not necessarily all the factors related to lateralization developed at the same pace. Maybe certain types of lateralizations developed more quickly in certain phases, while in others, other levels of lateralization developed. So just to say that the issue is extremely complex, and it is the impact also may be different for different age ranges. And so it is extremely difficult. Of course, what I can say is that if we think about the infancy, the stage of learning of dialogue, or when you learn about social behavior, if you think about adolescence, well, these are all phases in which the impact is different, learning is different. So the issue is interesting, but it should be broken down in many subcomponents.
That's a very, very complex question, and we can't get a very simple answer. I wonder though, Paolo, if you'd like to add anything briefly before I wrap things up for this evening.
Yes, I'm not really very much into lateralization in young age, I must admit. I'm under the impression that sometimes this scarce lateralization label is not being used very rigorously, simply because we have very few measurements, at least reliable enough, having to do with lateralization. So even if you surf around the internet, you read lots of bits of information which are not really double-checked on hemispheric lateralization, the famous right hemisphere, which is more creative, and the left one is more logical, etc. You really have to be careful when it comes to actually the sources of these things, which are just commercial considerations most times.
Thank you very much. I think through this discussion, we've all realised that lateralization is much more complex than sometimes it is set out to be. Certainly in more popular places. So, thank you very much for that discussion. It's been really fascinating. We had a lot more questions, but we've covered a lot of ground as well. So I hope that people who've sent questions in feel that Some of their questions have been at least partly answered, and I've really enjoyed this discussion. So we are now going to draw this evening to a close. Guido Gainotti, Paolo Bartolomeo, thank you so much for your presentations and for this discussion and for answering all these questions as well. Thank you everybody who's joined us live this evening and contributed to the discussion by sending in your questions. And just a reminder that the recording of this conversation will remain available on Fondazione Prada's website and the YouTube channel. And of course, the lectures, which are fascinating. And if you haven't seen them, I would encourage you to go and listen to those lectures as well, are up there on the website as well. And I do hope you'll follow us for the rest of this exciting series. The next conversation will focus on the bilingual brain, when we'll be asking, is it an advantage or a disadvantage to think and speak in more than one language? The video lectures for that particular session will be delivered by Professor Ellen Bialystok and Professor Jason Rothman, and they'll be joining me for another live conversation on Thursday, the 25th of November. So do put that in your diaries. I hope you can join us then. And as always, the 2 lectures will be available to watch in advance of the live conversation for 10 days on the Fondazione Prada website before we actually have that live conversation. And you can also send in your questions before the live event, or send them in on the evening as well. Until then, from me, Alice Roberts, and from our distinguished guests, Guido Gainotti and Paolo Bartolomeo, and from everybody at Fondazione Prada, goodbye, keep well, and stay curious.